So we're talking about CBD today, and Dr. Tom has his own unique introduction to CBD and where that came from. So just give us like a quick summary and how you got into this field.
Right. It's really, I fell backwards into it. It started with being part of with the Department of Health, educating people with medical marijuana. And that was about 8 or 9, 10 years ago. There's a practice that's licensed by the Department of Health. It's the only one of a kind. It's not even done in other states. So everything we do is licensed, regulated, overseen by the Department of Health. So when somebody's appropriate for medical marijuana, they're appropriate. They have to go through the proper steps. So we did that. And then we've been doing this practice has been around for about 8, 10 years. But in the last 2 to 3 years, CBD is now like in the forefront. And we figured, let's do a website, let's do some education. You can't find it online. There's no doctors doing this. So we started a website about 2 years ago called backtobasicsllc.com. And the main goal of it is not just buying really good products, but it's learning like how to use it, what's the right dose. Any good studies that I can find is on our CBD health tab. We do some videos, we do some blogging, but mainly it's about learning like what to do so you're not misled. And so we've been doing about a year and a half, and it's been great. We've had some great positive results from it. Doesn't help everybody, but it is a good therapy. The side effects are limited. It's really going very well.
Yeah, so we'll start like super high level CBD. What does it stand for?
It stands for cannabidiol.
So it's like a extract sort of from cannabis.
That's right. So when you think of CBD stands for cannabidiol. So CBD and THC are both cannabinoids. Those are the those are the cannabinoids are what you find in the hemp plant, the marijuana plant that causes their effect. So when you think of THC and CBD, they're actually cousins. That's the problem with it because people think I'm going to get high from CBD because it's the cousin of marijuana, but it doesn't happen that way.
How does it happen? Like,
So,
yeah, how is it different?
right. So the real reason why it's different is because THC binds to receptors. So THC, CBD, any other cannabinoids, as CBGs, CBNs, they all affect the endocannabinoid system. And there's two receptors, CB1, CB2. CB1 is mainly in the brain and in our spinal tissue. CB2 is mainly in our immune system, in our peripheral nervous system. So THC mainly works at CB1 levels, but it does it in a way where it interacts and binds to it. So now that receptor isn't working properly and we get that high effect. It doesn't, that effect is it's binding to the receptor. Now it doesn't work properly in our brain and we're getting a high. Same thing like with narcotics. When you take a narcotic for pain, the pain's not going away. My perception's different. It binds to the receptor that it's going to act at. Why CBD is safer is it doesn't bind to CB1 or CB2 receptors. It boosts their effects so they're acting normally. So that's why you don't get a high from it. It's just helping the neural tissue work better against inflammation. It helps our immune system work better, and it makes you feel better. So you'll never get a high from CBD alone because you're just boosting the receptor to work better. It's kind of the analogy of, say I got a car and I put rocket fuel in it. It's going to make it go faster. But the thing about CBD is you can't overdose on it because if I put tons of rocket fuel in it, it's not going to, the car's only going to go so fast. So it's only going to boost your immune system as much as it can. So it's almost like taking, say, multivitamins. When you take vitamin C tablets, the body's going to take what it needs. And what does it do with the rest of it? It gets rid of it. The same thing with CBD. So that's why we like to start at the lowest dose. There's no reason to take a lot of it. The lowest dose might do that enough boosting of your immune system for it to work.
Absolutely. And this like calms the body when you can have these receptors be more open. It can kind of calm the body. You're not getting high. the reason, if you're listening, I wanted to bring on Dr. Tom. We're talking about CBD, even though normally we're talking about food, body, and soul and stuff like that, is because anxiety is such a big thing for so many different people. And Dr. Tom's, one of his missions is to really make sure that people understand CBD from a really qualified and understand kind of the quality behind it, I'll say, and how it can help. I'm interested in it from an anxiety standpoint, but I also know it can be useful for inflammation, for
Right.
joint pain. What else can it be used? I guess are those the two biggest things, anxiety and joint pain, or maybe just general relaxation?
Right. The main reasons we talk to patients about is pain, any type of pain, joint pain, muscle pain. Um, the other reason is anxiety. It helps with sleep. It helps with general wellness. At very high doses, it helps with seizure prophylaxis. Those are really high doses. So when we talk about just saying for anxiety, we tell patients a low dose, 15, 20 milligrams, and you can use that multiple times in a day. And people get worried, like, am I taking a lot of this? But you're not, because people that need it for seizure prophylaxis to really saturate the brain, you need about 1,000 milligrams a day to 1,500 milligrams. So we're at the low end of the curve. You start at low, and that's usually how it works. You don't have to go to a high dose. But the reasons behind all of it, the same thing like how it helps migraines, how it helps anxiety, how it helps pain, is we have this stress, this inflammation in our body, and it's boosting our immune system to deal with that stress better and get rid of that inflammation. On our website, there's um, a, research about how it helps migraines. And essentially, what it's looking at is the mechanism, how it's decreasing the inflammation causing that pain. It's really very interesting. People have different concepts of why it's working, but that's what it comes down to. It's getting rid of the inflammation, getting rid of the stress of your life by boosting your immune system and making you feel better.
And what got you to switch from, like, you were in medical marijuana at this uh one of a kind health
I'm
center?
still doing that.
Yeah, so like what got you into CBD? Like was the CBD basically with CBD, as I understand it, if it's quality sourced and you're doing it the right way, there's like no downfalls of it. Like marijuana, memory loss, there like there's downfalls, there's
There
negatives
is.
to it. With CBD, I mean, I'm not hearing any negatives, which is kind of cool.
Right.
Is that what got you into it, or like was it just something new and you needed a change
It
in
was
life, or?
the first. No, the first thing was it was new, and I wanted to learn more about it. And this really got me to learn about it. And it it took a good 6 to 8 months starting the website, researching it, understanding it, and now it's easy for me to talk about it. And the other reason why is because I didn't find any doctors that understood anything about CBD. So I thought maybe we could be the point of reference for patients anywhere in the country to call about how do I do this correctly.
Hmm.
So that's how we kind of started this, and we've kind of just gone with it for the last year and a half.
And
It's been,
so,
it's been great. We've had some great stories with it.
yeah, like what any stories that come to mind that kind of exemplify the like what happens when you start in taking CBD in addition to some other stuff, or?
We had one woman here came with her daughter, and she was taking 6 Percocets a day. And the
Oh my
daughter was
gosh.
concerned because she was taking two in the morning, two at night, two during the day. It was helping her pain, but she was very groggy all the time. She wasn't that active, and she needed something different. So she came in, we did a whole hour of free consultation, went over everything. So she starts now with 2 capsules in the morning, 2 capsules at night, and she uses a topical for anything else additional. In about 4 months' time, she was off all her Percocets. Unbelievable, right? So her daughter says, she's still in pain, but the things that are improved is she's not falling, she sleeps better. She's never groggy. And you know what? With the narcotic, she was getting intestinal upset, so she's eating much better. So her quality of life is phenomenal. So she gets medications every month. She's off all her Percocets, and it's a godsend. She's been doing that for over a year. She's one of our first really great story in 2019.
Hell yeah.
Just today, a person walked in today, called me up. I need my capsules, but my wife needs the oil. Um, can I come in? Sure. So what happens is they come in and you start talking about why they're doing it. She amazingly is off her methadone now that she's on CBD capsules and oils. So what she does is she has pain all the time. The first thing she does in the morning is she does an oil and a capsule because the oil is going to work immediately and the capsule is going to work all day. She just gets it in her body and then she takes another one later in the day, and once in a while she uses another oil. And using this in the last 3 months, she's off all her pain pills. She takes a little bit of naproxen, and she uses CBD, and it works great because CBD is metabolized by the liver, naproxen's metabolized by the kidney, so it doesn't interact. And now she's off of methadone and all her narcotics. I mean, that was just the guy came in today, and we've been dealing with him and helping his wife for over this whole summer through COVID. So that's
Wow.
another phenomenal story.
Yeah, I wasn't even thinking about it being you hear all these the opioid crisis, right? Like I
Right,
wasn't even thinking that CBD could be sort of a natural replacement for all
right,
these opioids, painkillers, the things that are
right.
that's huge.
It's
That's
huge.
like that's potentially yeah.
Right.
Yeah, have you
The
heard of
major,
Nate Diaz in the UFC? Nate Diaz?
no, I have
He's like
not.
he's a fighter and he's starting to promote CBD for, because fighters they beat the crap out of
Yeah,
themselves and
yeah.
the joint pain and stuff. But yeah, I just was hearing about it and just seeing like this market, this incredible opportunity to, instead of having all these fighters be taking all these medications, and he was saying, hey, like this works, it's better. Like
Right.
I feel
Definitely
this
works.
tremendous potential. Yeah.
I've written under the CBD health tab about how it could help with exercise fatigue.
Mm.
And I found an article that talked a little bit about it and I expanded on it, but it makes sense how it gets when you're working out, you're breaking down muscle cells and how to get rid of that muscle, get the muscle recovery return quicker, the fatigue, improved. It makes sense to take CBD because it's going to get rid of that inflammation. It definitely has a role. It really does. I think it has a role for that. The problem with CBD is the roadblock is the cost.
Oh.
That's the problem. It can be very expensive. Insurance doesn't cover it. I do have a couple of patients that get it covered through their medical plan. Have written a note that they're using it medicinally, and they're paying into this plan through their work, and it does get covered. But outside of that, insurance isn't covering it.
Interesting. That's kind of a bummer. I guess it's not like it's really not mainstream yet, I guess.
No, it's not.
Yeah.
The
What about
problem is there's just too many. There's so many companies out there, and it gets very, very confusing.
hmm,
For regular medication, just like aspirin, it's very simple. People know it's 81 milligrams for the little one, it's 325 milligrams for the bigger one, and the instructions are there. But for CBD, different companies have different dosing, and it's very confusing. It's not regulated at all, and that's what we're trying to do. We're trying to standardize this. So when
oh,
people get medication from us, not only do they get a sheet about that product, how much it takes to get this dose. We have a dosing guide about what you would take for different types of medical illnesses. And again, anxiety, sleep, general wellness, and pain. And so you know where to start. This is the initial dose, and you can work yourself up from that. And
interesting.
so what we do is we talk to patients, and then we have a list of who's we've talked to, and then usually 2 or 3 weeks later, I'll call them again and say, "How's it going? Do we need to manipulate it? Are we good where we are?" And then you work from there. Most
Yeah,
people it helps. There are some people it doesn't do anything, but then there's a lot of people that don't do it because it costs money.
I see. Yeah. And I know you mentioned oils, you mentioned capsules. I know Nate Diaz in the UFC. I believe he had rolled a joint, right? So this is his
Right,
way of marketing it. He was
right,
like smoking a doobie, but
right,
you're not like you're not. I don't think
yeah,
they drug test and whatnot.
right,
But he was like, no, it's CBD, it's not weed. So he was all so
right.
you can smoke it, right? I guess so. There's
You
all these
can
different.
if you want. They do have that. We don't sell
Yeah.
that, but you
Okay.
can buy
Yeah.
a roll of CBD. Absolutely, you
I mean,
can.
I could see why it would get confusing. Like,
Yeah.
like what's the dosage and these three different modalities, and if there's different companies doing different,
Right.
levels and so
Right.
forth. Like where, like, so if someone has anxiety, like, or joint pain, let's go through both, right? Someone has
Right.
joint pain, someone
Right.
has anxiety. Where do you start? Drops, caps? Like how much?
Depends on the type of symptoms. Like
Okay.
anxiety, I love oils because it's going to work quickly,
Hmm.
5, 10 minutes. Like for migraines, anxiety, you want an oil. It's going to work immediately because you get it under the tongue, let it sit there, it gets absorbed into the body, and then you get the effect in 5 to 10 minutes. And then you can redose it if you have to in 15 minutes. Capsules are more for a person that's always in pain and they take it just to kind of get it in their body. And then they use the oils on top of that if they need something additionally.
So the
So
oils are
patients,
like quicker.
right, much quicker,
Okay.
much quicker. But my
Gotcha.
older patients, that generation, they love capsules. That's what they were brought up with. And that's what they tend to use. But they understand that it's not going to work immediately. It takes a half an hour for it to work.
So I assume it also kind of like it goes away slower. It kind of stays with you longer.
Absolutely.
Okay.
Right. An oil is
Okay.
going to work in 5, 10 minutes, going to last 2 to 4 hours. A capsule is going to work 6 to 8 hours.
Ah,
So it's going to last longer. So
interesting.
if you take the same dose of an oil and a capsule, the peak effect of the oil obviously is higher because it's faster and you get the effect quicker. The capsule takes a little bit longer. So I tell patients use oils for something acute like anxiety, for pain. You need it quickly relieved, stress. The capsules are mainly for people that are in pain all the time, or even somebody who's,
Hmm.
I have one patient who's high strung all the time. He just likes to get a capsule in his body and then uses an extra oil when the stress is worse.
Interesting.
If things are
Yeah.
minor and localized pain, I usually say use a topical because they're the cheapest.
Yeah.
If it's just elbow pain, knee pain, shoulder pain, use a topical first because those are the most
Oh,
inexpensive.
the creams. I
Right.
see. Okay. And what I love, I mean, so if you're listening to this and like it might sound like we're recommending to run away from pain but I don't, or like it might sound like we're basically saying take this to avoid feeling pain. But I really want to come back to this like CBD when we're talking about pain and the real pain people are in. It doesn't it's not like heroin. Heroin kind of, I've never done it, but or whatever, or like alcohol, it takes away the pain
Right.
and it sort of takes away the cognition behind it. Like you're not
Right.
present. You're not
Right.
present.
That's
CBD, I don't
correct.
know how to describe this, but you're there. You're
You're
not,
still there.
you're there. Like
Absolutely.
you're not,
Absolutely.
it's not distorted. I
It's
guess it
fixing the
relaxes you a
problem.
little bit, a
Yeah.
bit.
Yeah, it does. It helps your immune system make you feel better. It definitely relaxes you. We have a
Yeah.
one product. It's called Dream. It's really to help you sleep, but help you relax. It has the cannabinoids in it that help with those products. It has CBD in it, but CBNs are also another type of cannabinoid that's helpful for sleep and for relaxation. So there's different cannabinoids that help different things and different medical problems. And that's what we're still learning about. That's why
Yeah.
I think this all fits into what you're trying to do. I think this is
Yeah,
part
it
of it.
does.
This all kind of goes with what you're trying to do,
It's holistic.
mind and body.
It's not detracting from the present
Right,
moment.
right.
It's not an escape.
No, it's
I'm trying to
not.
wrap my mind. It's like it helps people kind of maybe calm down a little bit and feel more without getting overwhelmed in
Right.
some ways.
But
No, yeah.
it is fixing the problem, like that stress, that inflammation. Whereas when you take an anxiety medication, a narcotic, or even alcohol or THC, it's binding to the receptors. So like you said, your cognition doesn't realize it's actually there. But when
Yeah.
it wears off, it's still there,
Yeah.
right? And that's
Yeah. Uh-huh. Like you check out. You're it's an escape.
right.
Yeah.
But this is helping the problem.
Yes.
That's what's nice about it.
Yes. I'm almost like, I mean, I kind of, why not? Why not? What do you use for CBD? If it's not bad, do you just take it every day and it's basically good?
I use it
You
as
know, it's
needed. That's the best way. I mean,
okay.
but I have some people that do it every single day and it helps them. I have one person I work with. He's active military. So he needs the CBD that has absolutely no THC in it. And so he knows from me it's coming from a reputable source. He uses it every morning. It just helps him in the morning because the anxiety of the day, getting up, doing his work, it just helps him during the day. But that's another real, it's the first thing I ask patients when they're trying to use CBD is, are you worried about drug testing? Because there's three main types of CBD. There's full spectrum, which means that it's mainly CBD with a small amount of THC. Doesn't make you high, but if you do a drug test, it could come positive for THC. And then there's two others called broad spectrum and isolate, which have no THC in it at all. So those are important. If somebody says, I am worried about drug testing, I have 4 products, absolutely clean, no THC. One's an oil, 2 are topicals, and one's an edible. And in fact, we even have one vape pen. It's not on our website. People that want to use it are people that I know that their age, they come in, with the whole vape epidemic. I just want to make sure I know who the person is. We don't want people buying them online and I'm shipping them to a person that shouldn't be having them. So, but we have 4 or 5 products. There's no THC in it. If you did a drug test, it would be clean. So people that are active military, people with CDLs,
what's that?
Commercial driver's license, or a federal job who's getting drug tested. If you use some of these CBD medications with a small amount of THC, it could show presence on a drug test. My brother-in-law's good friend got fired because that happened to him. He did a drug test. He was using CBD and it became positive on his drug test. And that was an issue. In fact, the Department of Transportation notice from this year, it absolutely states that you cannot use CBD as an excuse for a positive THC test. I mean, it is black and white.
Sure.
Because they don't want people having an excuse now. They have THC and, they're driving an 18-wheeler, they have their CDL, and who's liable for that? I mean, it is black and white. And actually, that's on our website too.
Do you think, let's say 10 years from now, do you think CBD could disrupt, the painkiller market? I feel like it
has a possibility. I tell you, it has a possibility. It really does.
I feel like that would be so good for people. If the price came down and everything,
it would be great. I think medical marijuana is much better than narcotics, and I think CBD and THC done correctly can totally get rid of the narcotic problem in this country.
So what's the benefit of THC in there? Is that is THC, you do the medical side of things. So there's some THC that is good. There's some levels. Does that help with
some levels, right? If you go to a dispensary and you get pure THC, a pure THC product, it's for recreational.
Sure.
But when there's CBD within that medication, it's called a hybrid. The CBD actually, because it works at the receptor differently than THC, gives you less of the psychoactive effect. I really know, and they don't do this, when somebody overdoses on an edible for THC, what happens? They just get paranoid and they call 911, right? They don't know what to do with themselves. They go to the emergency room, right? And they just give them time. They just have to let it pass. If they took CBD, that would actually stop that effect quicker.
Interesting. The panic.
Because when you have the hybrid of the two, if you're doing a THC, medical marijuana medication with CBD in it, you don't get as much high, but you get more of the medicinal effect. THC is really helpful for people that have appetite loss, specifically people with cancer, people that are nauseous from, say, chemotherapy. It is absolutely helpful for people with muscle spasms, with multiple sclerosis. These are things that THC is absolutely good for. People that have medical marijuana license, I tell them, use CBD during the day. Your mind's clear. And then at night, it definitely does work better for sleep. I'm going to say that with THC. It definitely helps your sleep better. So a lot of patients with medical marijuana license at work, they use their CBD during the day, and then they use their THC at night when they need it for their pain, help with their sleep. for their other medical illnesses. So I think
Yeah.
there's definitely, they're definitely safer than, say, narcotics. The reason is also like CBD is not, I'm going to tell you right now, people always ask me, am I going to get dependent on CBD?
I was just thinking that tolerances and so forth. Yeah.
You absolutely don't get dependent on it. And that's another study we have on the website. Just put on a couple of months ago. They actually compared CBD with two anxiety medications that have physical dependence, like Ativan, lorazepam, and they tested patients that were, they considered drug liking. They had taken these medications before, and over a long period of time. I think they had taken it at least 12 months, and they compared the medications, and kind of over time to see if they felt more dependent on one than the other. And there was no dependence with CBD.
Oh,
In
that's so
terms of,
good.
it was unbelievable. It's a great study.
Yeah.
Other thing about THC, forget CBD, THC, physical dependence. We get physical dependence from narcotics, we get it from alcohol, we get it from nicotine, we get it from caffeine. THC, there's no physical dependence. I truly believe when somebody goes to rehab that's a star, an entertainment person, and they go into rehab for marijuana, I truly believe it's something else. Because you don't withdraw from marijuana. You might get some emotional dependence to it, but not a physical dependence where you have these withdrawal symptoms like narcotics, like nicotine,
Yeah.
like alcohol. That doesn't
Uh-huh.
happen. You don't really
Yeah.
withdraw to the point where you change everything about yourself physically. So
Yeah.
I love CBD. I think THC has a role, and
Yeah.
in
Hmm.
time, it'd be nice to see this replace some of our pain medications. The
Yeah.
problem right now is THC, marijuana, is still considered a Schedule One drug, which means there's no medicinal, reason for it.
Oh, interesting.
Like like
There's
like
not as much
cocaine,
research and like
right?
it's kind of
Right. That group is
see.
cocaine, LSD,
Mm.
heroin, marijuana. They're all Schedule One drugs. So CBD is affiliated with marijuana. So that's why there's not a lot of studies out there just yet.
Interesting. Yeah, because I fully agree with your perspective that basically to sum it up, CBD there's like literally like no downsides. Sure it costs maybe
None.
it's a little bit prices, but not dependent. It's not taking your cognition away. It's
No.
not ruining your liver. I mean, talk about like like I hate to say miracle. Miracle seems like, a burst of beaming light that
Yeah.
dramatically changes your life. I don't want to say that. I don't want to say that about CBD. I've had it before and
It's not a miracle. It's just another
yeah,
avenue to help patients.
yeah,
I
yeah.
had I actually had another company contact me and said, "You got to look at this video. We want you to sell our product." So I look at the video, and this woman couldn't deal with anything, her kids, her husband, and then started taking CBD, and all of a sudden now everything's perfect. And I'm looking at this going, this is BS. This is not
Uh,
like this. Don't make it look like this because
CBD will not make you a better parent. Well, maybe it might.
exactly. This is crazy. It does help, but it's not like a
It's
miracle
not.
drug. If you
Yeah,
look up
yeah.
CBD miracle drug, you're going to see so many blogs about it. It's
Uh,
another way to help. I don't think it's a miracle drug. But
yeah.
sometimes I look at stuff and go, oh my God, look, I'm a doctor pushing CBD. And I go, this looks like BS. Are you kidding me? You're like, come on, give me a break.
I bet. I mean, there's so much of that these days. It's
Oh, there
new.
is.
There's no regulation. Like it's like,
Yeah, there's no
yeah.
regulation at all. None.
So
That's what
you're,
I'm trying to help. I'm trying to
yeah.
standardize it,
Mm,
help people understand where to start, and then
mm-hmm,
go from there, and then follow up with them. Not just
mm,
say, hey, buy this, use a dropper, and good luck.
mm-hmm.
We want to follow up, act like it's a medical practice, and follow up with patients and give them the right answers. And it helps most patients. It's just that the roadblock of the cost it's tough. But I think I have to say, since we started doing this about a year and a half ago, the prices have come down a little bit. And I think it's all the competition.
Sure.
Our medications have gone down in price because we've gotten to buy them cheaper because these companies want us to keep buying them. So
Yeah.
it's a slow process.
Yeah. Interesting. Yeah. I'm a big, I like, well, I've always been more open to sort of, I'll say, alternative substances that I believe are kind of uh, less mainstream, that kind of get
Right.
poo pooed. Another one, psychedelic mushrooms. I feel like they are also sort of in the same category where
Mhm.
there's a lot of cultural baggage. People don't understand
Oh
them.
yes, I'm going to be
And
honest. I don't understand them either.
yeah, and I mean, it's just like, they've really benefited me.
Yeah.
They've benefited many other people as well. But there's so much, like, I really feel that with both CBD and psychedelic mushrooms, that, done safely, done the right way, it's people are missing out. It's like it's right there. It's like,
Mhm.
imagine if you were, starving in dehydrated, thirsty in a desert. You're like wandering for water, and then like just around say there's a bunch of sand dunes, and like you're looking over, like just over that sand dune, there's water, like just
Right.
right there. Like, you're so close to it. It's right there, but people can't see
Right.
it. So
Right.
I've always had a soft spot for, really, this is it pretty much. There's CBD, there's psychedelics done safely. I'm kind of starting to get into nootropics,
Hmm.
but I'm taking my time there. I actually just ordered some recently, but I haven't tested it. I'm kind of testing it out myself and
Hmm.
everything. But I normally don't recommend chemicals. I just, I'm like
Right.
the yoga guy, right? I'm the
Right.
figure it out
Right.
with your diet, figure it out with your sleep, figure it out with your, Dr. Fauci
Absolutely.
said, the top three keys to not getting COVID: get good
Right.
sleep, watch your diet, and
Right.
reduce stress. And like, I'm a firm
Right.
believer in that.
I read an article a couple of years ago. That's exactly right. It's how to live longer. You said it right there. Eat well, stay active, and reduce your stress, whatever it is. And it's hard to reduce your stress, work, family, all the other things that come with living. But those are the things that you need to do. There's no magic pill. That's why I won't say that this is a magic pill.
Yeah.
This just
Yeah.
helps with your stress, helps you feel better, and hopefully it helps you be more active.
Absolutely. Yeah. I feel it.
So it definitely, like, I think this is definitely, we definitely are doing the same thing, different sides of the spectrum, but it definitely works together.
Yeah. Absolutely. So like, what's next for you? Like, are you working on the regulation side of things, or what sort of, like, because you're involved in any other organizations that are kind of
Right.
working on things from a
Well,
policy
I,
standpoint at
I
all?
do a whole bunch of different things. I'm in hospice. I'm in a wound center, Newport Hospital, help people with pain management with steroid injections. Again, talked about medical marijuana with the Department of Health. But with the CBD part of it, what I really want to do is be an educator.
Hmm.
One of the things I just became part of is with a company called Hemp Meds, which I do like them a lot. They're one of only two companies recognized by the physician desk reference, which is kind of the book with all the prescription medications. They have one medication as a supplement that is recognized as the right, they did the right steps to get accepted in this reference. So what they want to do is be that education center for doctors, patients, for consumers. So I'm on the hemp meds advisory board, the medical board, which is nice. So I think this is what I really want to do. I want to be that part of that big group that not only does the education, but might be the center to get certified medical credits, CMEs, the place where you get to talk to not only patients, but doctors understanding why this works. And
Yeah.
and we have about 12 people on the board. And it's, like I said, I think you would be perfect for this, by the way. You'd be perfect because it's not just doctors. Exactly. We're going to definitely figure this out. But it, they have, physiatrists there, physical therapists, people that are in chiropractors. It's not just doctors. It's a handful of doctors, but people that want to do it the natural way. That's the goal here, is to be that person, that practice that people call us to ask us, am I doing it right? How do I do it? Is this the right medication? It's been a slow process, but it's getting there. Slowly but surely we'll get there.
Yeah, and where you mentioned it in the very beginning, back to basics llc.com. That's kind of where people can find out. And it's
Right.
spelled, so how do you spell that?
It's BAK number two basics LLC.com. And then like you do I do a podcast.
We gotta get you a simpler name, man.
I know it's too much. And then the easier go if you do if you search I know if you search the podcast, just write CBD Health Dr. Rocco or CBD Health Podcast, and they do the same thing here, just talking and helping people understand a little bit about what they need to understand with
Yeah,
use. So
yeah,
that's I'm trying to do. It's like you're doing what we're just
yeah.
trying to disseminate the right information so
Uh-huh.
people know what to do.
Uh-huh. That federal label of marijuana being a Schedule One, I feel like it. Well, I'm thankful that I think they're voting, right? Or the House is
And
whatever,
it's
whatever,
not
what,
even
yeah,
it's not
yeah,
even close. I was at
yeah.
last June. I was at a pain conference learning about narcotics and doing it correctly, and the woman there was unbelievably awesome. Older lady, physician. She did it the right way. Like if you were going to get narcotics, she did it correctly. She would see patients every month. She would assess them properly, check their function. But at the end of the conference, she talked about CBD and THC. And she mentioned that it's a great avenue, but there's problems. And I absolutely like raised my hand. I go, I know what it is. It's because it's a Schedule One drug and it's affiliated with marijuana. I goes, you're absolutely right. And I went on a rant for like 15 minutes. Like she had to like shut me up because this woman liked to be in charge. And it was, but she's afterwards, she goes, you hit every right point. And that's the
uh,
first problem. We got to get marijuana as a Schedule 2 or 3 drug, and then things will flow from there, meaning that there's not going to be any educational or National Health Institute grant about a Schedule One drug.
yeah,
I can tell you they did do a grant for it was $3 million. That's what it was. It was $3 million grant for 10 places to look at CBD use for chronic pain. And
yeah,
there's different locations in the country. $3 million sounds like a lot. That's nothing. Usually when you do a grant, it's like $100 million,
mm,
when you're looking for real research. But at least they're starting somewhere to look at
gotcha.
CBD. Is it going to help with pain? So I was excited about that. That grant just started in 2019. So hopefully by the end of maybe next year, we'll get some information from that. So they're at least thinking about that. But the Schedule One is just
Uh,
making it so difficult for medical marijuana being acceptable through every state in the country. And then it's also the problem with CBD. With me talking about CBD, a lot of people think I'm going to just automatically go into marijuana. They don't want to hear
mm,
about that.
yeah,
That's not what we're doing here. If you look at our website, it's all about CBD. It's not about marijuana. I can easily talk about it, but that's not the goal. The goal is, hey, let's try something. You don't need a medical marijuana card. It's legal. Just do it properly. Know some of the pitfalls. And the main pitfall is if you're somebody that gets drug tests, you
uh,
could be positive if you use the wrong one.
mm,
But I will tell you, the one that does have a little bit of the THC, it has it's called a full spectrum medication. They actually do work better because the CBD and the THC have a synergistic effect. They call this an entourage effect. You actually do get a better effect at the same dose if you took it just the isolate with just CBD in it. So people that use isolate, I tell them you might need a little higher, dose. That's fine, but you have to know that. That's all you need to know.
yeah, yeah. I feel it. Um,
I'll send you some.
yeah, yeah. Thank you. That'd be awesome.
But, yeah.
I wonder. Yeah, we'll figure out. I feel like we're kind of reaching a stopping point. I wonder. I hear everything. I feel like yeah, this is a pretty good. Am I missing anything? What anything? Yeah,
I
I
could
feel
go
like
on
this
for
is
another hour if you want.
yeah.
There's so much to talk to. That's why the podcast is easy for me to do. All right, I think of a subject, I write some notes out, and I can talk for a good, 15, 20 minutes on just one thing like sleep. And then,
Yeah.
you're going like different ways of using the dosing. And it's, there's so much to talk about. We just hit the tip of the iceberg.
We might have to have you back another time. We'll figure it
Absolutely.
out.
Yep.
Okay, let's wrap things up for the day. Thank you so
Good.
much for coming on.
Absolutely. Love it. Thank you for having us.